What are the ethical lines in gene editing for therapy versus enhancement? Imagine a future where we can fix genetic diseases with just a few edits or even boost human abilities beyond natural limits. Sounds exciting, right? But where do we draw the line? That's what we're exploring today. Gene editing technologies like CRISPR have opened up incredible possibilities. They let scientists cut and modify DNA with precision, targeting genes responsible for diseases. For therapy, the goal is to treat or prevent serious health issues like cystic fibrosis or sickle cell anemia. It's about restoring health and reducing suffering. Enhancement, however, aims to improve traits like intelligence, physical strength, or appearance. It's about making good things even better. When we look at medical ethics principles, the first is autonomy. Patients should be able to decide about gene editing therapies once they understand the risks and benefits. This respects their right to make choices about their health. But with enhancement, the question is whether future individuals can truly consent to changes made before they are born or even conceived. It's a tricky area because it involves choices made for people who aren't yet able to decide for themselves. Beneficence and non-maleficence are also key. Therapy aims to do good by curing or preventing disease, aligning with these principles. But safety is a big concern. Off-target effects or unintended genetic changes could cause harm. Enhancement might not always promote well-being and could introduce unnecessary risks, especially if the benefits are uncertain or marginal. Justice is about fairness. Access to gene therapies should be equitable, so no one is left behind because of cost or social status. Enhancement raises worries about social inequality. If only wealthy people can afford to enhance their children, it could widen existing gaps and create new forms of discrimination. Safety is especially important when it comes to germline editing, which affects future generations. Changes made to reproductive cells can be passed down, and scientists worry about long-term effects that we might not yet understand. Many experts call for caution or even temporary bans until we have better safety data and clear regulations. Respect for human dignity and naturalness is another concern. Therapy is seen as restoring health and respecting human life. Enhancement, however, might be viewed as playing God or altering what it means to be human. Society debates whether such modifications are acceptable or if they undermine our natural human traits. Finally, governance and public discussion are essential. Because gene editing has profound implications, transparent rules and broad societal conversations are needed. This helps ensure that policies reflected shared values and that technology is used responsibly. In summary, using gene editing for therapy is generally supported when safety and ethics are carefully considered. It's about fixing health problems and helping people. Enhancement, on the other hand, raises many questions about safety, fairness, and what it means to be human. That's why the ethical boundary is mainly between healing and improving, with therapy grounded in well-established principles and enhancement requiring much more careful thought.